Believe it or not, this month marks 3 years since the World Health Organization declared COVID-19 a pandemic. And while cases and hospitalizations are down, the disease is still part of the everyday lives of Americans who are battling long COVID. Editor-at-large for Public Health at Kaiser Health News and CBS News medical contributor Dr. Celine Gounder met a patient whose life changed forever after her diagnosis. Dr. Gounder joined her at a post-COVID clinic to learn about the new ways that doctors are helping patients regain some normalcy.
Almost there.
For Trevor Taylor, most mornings start off like this, one small step at a time.
Finishing strong, huh?
Yeah, let's finish strong.
It's been an uphill battle for the 57-year-old who told us her COVID diagnosis in January 2021 nearly killed her.
It was scary because I remember my eyes being open, but everything was black. I remember the nurse saying to me, you have to fight. The person next to you is dying, and if you don't, you're going to be in this body bag. You got to fight.
Taylor wasn't vaccinated at the time. She was rushed to the hospital on the same day that she was scheduled to get her first dose of the COVID vaccine. Since then, she's been out of work, and instead of driving to the hospital to her old job as an administrator, she makes the trip multiple times a week for physical therapy.
Go for 2-minute intervals if you can, and then just take a break. The timer will stop, all right?
I do my therapy. I come home. I can't move off the couch. So for me, I'm up and down like a roller coaster. 1 minute I breathe good, next minute I don't. And then when I have a lot of activity for a day, I can be down for 48 hours. Cannot get out the bed.
So the whole way up?
Taylor's become one of millions of Americans to experience long COVID. Her case so severe that she relies on oxygen to get around.
There you go.
Right here, my love. You did it. Home stretch. Look at you.
For 2 years now, she's been visiting NYU's post-COVID care program.
It's coming out my throat clear.
Where she and 1,000 other patients are treated by pulmonologists like Dr. Rainey Kondos.
They have what we call symptoms that are associated with their COVID infection, but are now lingering longer, and so long COVID. It is a major problem if you think of the fact that about 25% of patients may end up with long COVID. And if you're talking about millions and millions of patients, you can imagine that that's a large number.
Patients with long COVID commonly experience symptoms like fatigue, brain fog, shortness of breath, and chest pain.
Now let's compare Trevor to other patients with long COVID. How is she similar or different from some of the other patients?
So she's fairly representative of the patients with severe COVID that we saw pre-vaccination during the early days of the pandemic. These other patients with long COVID didn't have severe COVID. They had a cold, and the cold got better. And then a few months later, they can't get out of bed. Most of the long COVID patients that we're seeing are those that were healthy and now have lingering symptoms.
Whoosh! Don't stop, don't stop, don't stop. Keep going. You got this, almost there.
One way to monitor those symptoms is through breathing tests, which Taylor receives every 6 weeks. While exhausting, the tool measures her lung function and tracks her improvement over time.
Easy. Relax.
In what ways does being a patient in a program like this help patients heal?
Many of these patients were going to their primary care doctors, and their primary care doctors were telling them they were crazy and that there was nothing wrong with them and they should just go home and forget it. And they felt very unheard. And I think what we're trying to do is provide a place for them to be heard.
Hi, yes, I need to reorder oxygen for myself, please.
How many tanks you are requesting?
I'm requesting 4 tanks, 2 small, 2 tall.
Trevor, what would you like people to know about long COVID?
I would like for people to understand that, first, long COVID is very real. It's not something that's in your head. It's not an imagination. Trust me, I would do anything not to be like this. Every day getting up is a fight. Every day to breathe is a fight. But it's worth the fight because I love people and people give me energy. And as long as I can show a fight, I know that there's a chance.
Taylor is in the process of being evaluated for a possible lung transplant, a clear reminder of the long-term effects of severe COVID. The good news for so many other patients is that COVID vaccination reduces the risk of getting long COVID by at least half, according to a study in the Journal of the American Medical Association last week.
Yeah,
do get
and
it-
as you point out in your piece, she was that close to getting the vaccine before she was diagnosed, right? This is when vaccines were first coming out.
Right.
Was she 2
Right,
days?
January 2021. So she's a hospital administrator. She has her appointment, and
Yes.
she gets COVID just a couple days
Right
before her
right.
first shot.
If you do get long COVID, is it forever COVID, or will you eventually be kind of cured
good
and normal
question.
again, or to
Yeah.
whatever your life was before?
Well, in her case, she had such severe lung damage. I mean, that's why they're looking at giving her a lung transplant. So that's not a curable condition. That's permanent organ damage.
In general, can people who have long COVID, though, expect to recover?
Maybe. Some people are getting better with their symptoms over time, and we are looking at cures. There's a study right now looking at Paxlovid, the medication you use during a COVID infection, to see if it might also help treat long COVID.
All right, Dr. Celine Gounder, and Vlad's daughter. Don't you think she has one of the prettiest names you've ever heard? Yeah, you do.
I agree.
Now that